Hello, everyone. This is Savannah from IU, and I'm just going to do a brief video of going over the informed consent. So I'm sure you've all given informed consent, but I just want to go over it real quick just in case. So this is the informed consent that was just approved. So this is one you should use to submit with your IRB and make sure that you change. Of course, like we talked about it, change so it doesn't say IU anymore, and so that your down here, your compensation, wherever it is right here, aligns with what you think that you want to do. So this informed consent has the new common law in it, so it actually makes it a lot easier so that you can have basically a cover page with little bolded titles that give a brief of everything that the patient may want to know. So at the top here, I'll start at the top. There's our PIs at the top, Dr. Galre and Dr. Chalasani, and then it has Dr. Chalasani's phone number, and then there's also a GI on-call 24 hours a day phone number that you can call if they have any questions related to their health, and then also the IU Human Subjects Office phone number that they can call if they think anything sketchy is going on with the study or with me as a coordinator or anything like that. So moving on, this is just the little cover page I was talking about. So it just has some quick points that you can go over with them really quick. So what should you know about this research? How long will I be in it? And of course, if they're AAH patients or heavy drinkers, it'll be 6 months, and then every 6 months after the week 24 day 180 follow-up for up to 5 years until the study is over. And then why is this research being done? What happens to me if I agree to take part in this study? Could being in this research hurt me? Will being in this research benefit me? And you can go over those with them. And then going down to the rest of the informed consent, it goes just a little bit deeper and into the study. So they'll be in it for 6 months, like we talked about, and then it explains what each study visit would include, which is nice. So that's the most important thing most of them want to know. So has questionnaires, give a little blood, urine, physical exam, questions about their health, things like that. And then going forward, what will happen to your samples collected during the study, what we do with it. So we save it here at IU, and then quarterly we ship to UMass. And then after the study, what will happen to their samples? Sometimes they'd like to know. It's important to tell the patient the risks of being with study. So since it's an observational study, there is very little risk. So maybe a bruise during blood draw, a loss of confidentiality. There's not really anything other than confidentiality in the blood draw, and it's important just to reassure them that, you know, we always do our best during blood draw, and the confidentiality, we make sure to do our best to not lose that. So we de-identify our patients and make sure that their personal information is locked separate from their numbers so that they don't, if ever anyone were to ever break in, then they would not be able to identify the patients. So there are no benefits for taking part of this study other than, you could say, you know, helping somebody in the future, maybe, possibly, but no direct benefits. So there aren't any alternatives to taking part in this study. The study is completely voluntary. So that's important for them to know, that if they say they want to be in the study now, but in 6 weeks they decide they don't want to be in the study, that it won't affect their healthcare. It won't affect anything. Nobody's going to be upset with them. It's important for them to know that they can opt out at any time. Like we said, confidentiality, just go over that with them again, that everything is de-identified and all of their samples and all of that is de-identified, so nothing can ever be traced back to them. and legally nothing can be traced back to them if anything were to happen. So genetic information, and of course going over that, and then there's no cost to be in this study. So that's important for people to know sometimes. So payment, this is what IU is paying. So of course this will be different for you if you have a different payment that you set up with your PIs. So we're doing a $50 gift card for each patient at each visit. So it'll break down $50 to healthy donors, $100 to heavy drinkers, and $200 for the alcoholic hepatitis patients for each visit that they come to. And I think we decided on Walmart gift cards. So if you guys think that is something that could work for you, that's something that had worked for us in our last study. So it's different for everyone. Compensation for injury, of course, if anything were to happen due to the study, that we would cover it, but directly due to the study, not anything above that. It's important for people to know. We've had people that thought that they were in the study, so they thought that they could go to the dentist and get all this other stuff done, which is not the case. And of course, all these phone numbers for people to contact about information. Dr. Galray, Human Subjects Office, and then the 24-hour GI fellow on call. So if they have any questions about that. And of course, like saying again, it's completely voluntary. Do not have to be in the study at any time. If you decide you don't want to be in it, that's fine. And then this is where they sign that yes, it's okay to keep samples, or no, samples for future research if we have extra samples at the end. And then yes or no, it's okay to keep DNA samples. They do not have to do DNA, so people can say no to this one. And then of course, print, sign, and date for the subject. And then as the coordinator, you'll print, sign, and date down here, or if there's a LAR, print, sign, and date. So that is the gist of informed consent. If you guys have any questions, please feel free to reach out to me or to Kayla or to anyone else. And that is all. Thank you.